Okay, so today we're going to learn how to draw up the testosterone. You should get syringes from your pharmacy and also alcohol swabs, and then your testosterone should be this size of vial if you're a female. For our males, it will be a little bit bigger. One thing that you'll want to make sure that you always do is you're always going to want to wipe the top of the vial every time you do an injection and where you're going to do the injection. So we'll just go ahead and wipe the top really good. And then we like to do the injection in our love handle area. So I'm just gonna wipe that area so that it can dry. One thing that I like to do is I like to pressurize the vial so that the testosterone comes out faster. It is pretty thick and this is a small syringe, so we'll wanna make sure that we do that. You're gonna pop the orange cap off, insert it in the testosterone, tip it upside down, and it doesn't matter what size syringe they give you, whether it's 100, 50, 30, you're going to always pull it under the 5, okay? So if for some reason they give you different size syringes, just know that your dose is always going to be under the 5. So I'm gonna pull it all the way down and pump up some air into the vial to help pressurize. And then I always like to pull it down past where your dose is, just so that we make sure that we get all the air bubbles out. So if you want to zoom in, you can see there's a little bubble, so we're just going to keep pulling it down. And it is super thick, like I said, so it does come out super slow. Is it 4 or 3? Mm-hmm. 4. Okay. So we're just going to keep pulling it down more so that we get enough and we don't have any air bubbles. And I'll just keep pushing it up. Okay, so if you look, right now it's at the 5, so we're going to just push it up a little bit past to the 4. And there's not any air bubbles in there. So once you've done that, you're going to pull the syringe out. And you're going to want to make sure that you come in at a 90-degree angle. So I usually like to pinch and then just come straight in. Make sure that you push it all in, and like I said, it is thick, so it might take a little bit more time. Pull it out, and then you're done. What you can do is you can take and bend the syringe, the needle all the way back, and put the cap back on and throw it in the trash, or you can get a sharps container off of Amazon. And that is it.